Hi, everyone. I am Ehsan Adeli, an assistant professor at the Department of Psychiatry and Behavioral Sciences. I lead the Stanford Translational AI in Medicine and Mental Health lab within the department. I'm an AI scientist by training and apply my knowledge to solve critical problems in neuroscience, healthcare, and mental health.
Yeah, thank you, Dr. Adeli. And Dr. Martinez Martin?
So I am an assistant professor at Stanford Center for Biomedical Ethics, which is in the Department of Pediatrics, and I'm also appointed by courtesy in psychiatry and behavioral health. My background is I am an ethicist. I am trained in law and social sciences. And I came particularly to this interest of the ethics of mental health because I see this great promise of, how AI can really benefit the field of mental health, while at the same time, it raises these ethical issues, which are challenging and that, do need to be addressed in order to realize this benefit.
Yeah, thank you very much, Dr. Adeli and Dr. Martin. This is an amazing background, and we are really excited to dive into this crucial topic of AI and mental health care in the next 45 minutes or so. So let's begin, just jump in and begin with our first question. Dr. Adeli, can you sort of explain how AI is currently being utilized in mental health care, particularly in your research?
Yes, thank you. So AI and machine learning are being leveraged in mental health care to assess, diagnose, and even help treat mental health disorders. They can provide objective, reproducible measures of mental health conditions, complementing the traditional methods like self-reported questionnaires. In one of my research projects, we are investigating AI therapists or mental health companions that are basically chatbots and coach bots for psychiatry. They use large language models or LLMs that everybody's familiar with these days to provide mental health support to patients. But beyond that, I can talk about other exciting innovations later on. But for now, I should say AI could be used to offer high-quality intervention and sometimes treatment to a large number of patients at a low cost, providing timely and personalized information. Although I want to strongly emphasize in the beginning that there is the necessity of human interaction in mental health care. It's vital to recognize that technology should complement, not replace, the compassionate care provided by professionals. Human connections remain irreplaceable in understanding and addressing the complexity of mental health. I'll stop here and I'll talk about other projects later on.
Oh, that's amazing. I'm so glad you mentioned the human component of AI, which sort of a lot of times is ignored. And AI technologies are to augment human capacity and not to replace them. So you talk a lot about large language models, and there are other things which are happening in vision and other sort of things. So in particular, what are some of the exciting innovations from the Silicon Valley or outside in AI, which you think can be sort of applied to mental health? And in particularly, we really want to know some of these technologies which you're currently working on.
Great question. So one of the most exciting innovations I'm passionate about is the development of ambient intelligence systems. Ambient intelligence refers to technology that uses sensors and AI to passively and quietly monitor and respond to a person's environment and behaviors without being intrusive, often in ways that enhance their daily life or healthcare. It's like having a smart, invisible helper that keeps an eye on things to support your well-being at home or at the workplace. We use ambient intelligence for detecting what we call neuropsychiatric symptoms, or NPS for short, passively and remotely. These systems use in-home ambient sensors and computer vision algorithms to monitor patients' behavior, allowing for accurate, non-intrusive assessments of NPS over time. NPS are known to be early indicators of neurological conditions in older adults, including dementia and Alzheimer's disease, and several others. I often refer to this technology as a vital signs monitor for psychiatric conditions, in the same way that a smartwatch can measure one's heart rate or blood oxygen levels. Future ambient intelligence technologies can measure behavioral and psychiatric conditions and provide timely and relevant information for clinical interventions. One more exciting project we are working on right now is an AI-based tool for detecting depression and anxiety during pre-visit rooming. The preliminary data and results show promise in integrating multimodal AI. By multimodal, I mean videos, audio, and the content of what they say, text, language, into integrating that into routine clinical workflows, improving early detection and intervention.
Very nice, very nice.
And Dr. Supekar, mental health AI, it holds great promise for improving diagnosis. So in your research, what specific methodologies can healthcare providers adopt to enhance diagnostic precision and reduce the time to diagnosis for mental health disorders?
Yeah, again, a great question, which sort of aligned to some of the points which Dr. Adeli mentioned, which is so unique to mental health research, which, unlike other areas of medicine, the diagnosis of mental health conditions, as most of you know, still relies heavily on subjective assessments by providers, which we all of us know are very limited and can lead to inaccurate or delayed diagnosis. So my research has sort of tried to address these issues by developing objective and accurate brain-based diagnostic markers, which are sort of complementary to what Dr. Adeli has mentioned, like video and passive censoring. The advantage of adding a brain-based diagnostic markers is that it also gives insights into the neuroscience of these conditions, which we can actually target to different therapies or treatments like TMS. So we have developed these biomarkers, brain-based markers using brain imaging for conditions like autism and schizophrenia, and sort of leverage our connections and the capacities of advanced AI-based methods. And I really believe that with further validation, this is of course work in progress, that these brain-based biomarkers could be really implemented in the clinical settings, along with ambient intelligence, for example, for earlier and more precise diagnosis. And again, to stress the point, to augment the capacity of the mental health care systems and not to sort of replace humans in the loop here.
This is very exciting, Dr. Supekar. I want to actually follow up on that. How can healthcare providers utilize AI-generated neural fingerprints and biomarkers you talked about to develop personalized treatment plans for mental health patients? And what implications does this have for improving patient outcomes?
Yeah, again, a great question. So other side of the story is like, one, you have the diagnostic aspect and the other is treatment. And currently, basically both in clinical trials and mental health care clinical trials of, drugs or any kind of behavioral treatment or interventions, rely on clinical assessments to measure treatment outcomes, which are highly subjective, unreliable, and sort of lack a biological basis. And so typically when you have a drug or a treatment, you collect some behavioral data at time point 1, and after some time point, you again collect some other behavioral data. And these are again collected subjectively, and they do not have some kind of neuroscience-informed knowledge along with it. So what we have developed is sort of similar to human fingerprints. We are trying to create neural fingerprints that are specific to an individual. And these fingerprints are objective and reliable, and making them a very robust and quantitative and objective measures of treatment outcomes. these also can be used, which we are in the process of using, to objectively identify individuals or patients with psychiatric conditions who are likely to benefit from a treatment before they begin the regimen. One of the biggest challenges in mental health care treatment, as many of you know, there are many treatments, and the one-size-fits-all approach, which is very prevalent in healthcare, unfortunately does not work in mental health care because the conditions like schizophrenia, depression are highly heterogeneous. And one treatment might work for one patient, and other may not work. So we could use these brain-based neural fingerprints to actually identify before actually giving them treatment, which are sometimes have a lot of side effects, to say that with certain degree of confidence that, hey, you should use this particular drug and you are more likely to be beneficial compared to this other drug. And the hope is these advances pave the way for better personalized therapeutic strategies and eventually leading to improved patient outcomes, which is our goal. So, we talked about, this great technology and which can do passive sensing, find diagnostic markers, and sometimes, it just feels like science fiction. And these have, but they have been shown to work really, really well in non-medical applications as well. But one of the things like transformative technologies like AI, even though they hold great potential, they also present unique set of challenges. And chief among them, which is, has been recently come to fore a lot, is ethics. So Dr. Martinez, you're an expert in this field, one of the leading experts in the world. So I really wanted to get to know from you is like, what are the key ethical issues that arise from using AI in mental health, and how, and more importantly, how they can be mitigated?
Thank you. So I'll start by just identifying just some of the primary issues. More broadly, one of the issues, you brought up science fiction or mentioned kind of science fiction. And with AI, we had an existing way of handling things like safety, like privacy, but they were based on a previous system. And so when you bring this new technology into it, it can mean that our existing ways of handling the ethical concerns need to also evolve and adapt in order to handle the sort of new world of technology that's available. And an example of that might be accountability or safety, where we had a framework with the FDA that was really meant to handle certain types of medical tools, and now has had to keep up and and evolve in order to meet challenges of dealing with things like software and being able to evaluate whether an algorithm that has been trained that is working effectively, initially whether that's going to work in multiple sites and how to evaluate that. Privacy and data protection are also obviously, and I'm sure these are often the first ethical issues that come to mind, but they're really prominent because our previous ways of thinking about privacy or handling data protection are challenged by this new system where there is really just so much data available, many new ways of computing. So previously, it was thought, well, de-identifying the data is going to handle these kinds of privacy concerns. But more and more, data can be re-identified, through these new computing approaches. You also have, I've worked on, ambient intelligence, which Dr. Adeli was talking about, which is really a promising and wonderful tool, but it also is collecting data in ways, that people are going about their everyday life and being in a hospital or otherwise where they may not be used to thinking about what are the implications of having data collected in this way. And so, for example, that then needs to be either addressed, whether it's in the design of the tool or thinking through whether additional privacy protections are needed. And often in these instances, people think, well, consent, as long as people consent to this, it's fine. But often people are not aware of some of the downstream implications. Again, with these new abilities to, re-identify people, with being able to use data for lots of targeted marketing in ways that might have implications for people, whether it's their jobs, education, or things like mortgage rates. And I should say this especially can be a concern in something like with mental health because of the way data gets used to predict behavior or predict profiles of people that can also really support some downstream impacts of this data that people are not aware of. And that's where, along with consent, there would need to be more education. And then quickly, I'll touch on, because I know that we'll have more chance to talk about this. But for example, bias is a huge concern, which really ties to, are the tools going to work for different kinds of people in different contexts? Is really, and are there some groups, whether it's for racial, ethnic, language, disability, who these tools are not going to work for in a systematic way that's going to exclude people from those benefits. And bias can come from issues such as the representativeness of the data that's being used to train the algorithms. But it also really entails broader concerns about how people are recruited, where data is taken from, is obtained from, in and how representative that data is, but also, as some people have put it, a broader problem that, when data and information is being collected from a whole system that we all know has a lot of inequities built in that system, how can you expect that data to be, fair, and have those resulting tools can be fair? So it's a thorny problem. And also, as Dr. Adeli mentioned, there are a number of questions in terms of the ethics of how AI tools may impact whether it's quality of care, whether some people may think of the tools as being more objective than the clinicians who are applying them, and how that might impact the therapeutic analysis, how having data collected from a tool, what might need to be in place so that so that people can still feel secure, when working with the clinician. And there are, really a need to look at where tools can beneficially, be brought into, the work of mental health in order to help, whether it's scheduling or, of course, things like helping to identify appropriate treatments, but where really human judgment is always going to be needed, such as, what to do when someone is really in crisis. Generally people talk about a need to really have that human touch there. And in working with, clinicians or talking to therapists over the years, I also really think there needs to be a respect for the creativity that they bring often in working with patients. And that's often a really critical element of finding the right approach for a patient. And so that is part of the human touch. And I think something that also often needs to be thought about in terms of how and when AI tools can most benefit when brought into diagnosis and treatment.
Well, thank you for that amazing response. I think all of us sort of agree that ethics is such a multifaceted problem, and especially when it relates to mental health care, it provides unique set of challenges. And I'm so glad that experts like you are actually participating, involving, and contributing to the field, which I think would really lead to equitable solutions in the future. So I also teach a course on AI and mental health last few years, and one of the things we talk about everything, but one of the things which gets the most attention from students, and they're like, "Wow, it is about bias." And when we really show that these AI applications have inbuilt biases in the system, and they are, They don't know how to respond. And these are real cases. And we have had cases, I'm sure you're aware of, where the technology was superior, everything was awesome, but they have been withdrawn from use after being found to exhibit biases against them, against certain group of individuals, which is something you referred to as well. So looking on a sort of, in the future sort of things, like how should we sort of address concerns regarding bias in your algorithms, especially for mental health, which is very critical for the reasons you mentioned?
Yeah, so I have to say one thing you already said is heartening, which I think education is really a part of that piece.
Yeah.
The course you're teaching, and it's always heartening to really see how much students, people coming up in the field respond to this, as in they want to make things that are going to treat people fairly and not systematically exclude diverse groups from the benefits of treatment. And so, some of this I know, Dr. Adeli, attends to in his work in terms of ways of addressing bias. And so in terms of, technical fixes, I think there are a number of things that are being discussed, that are being, brought into work, and they're certainly helpful. But myself being an ethicist, I'll just say the technical fixes are very important. But it's also really important to look at and have ways of addressing the ways system, in the wider system in which a tool is being created and is going to be used, that fairness becomes an issue. Again, going back to that, when you have a larger system that is full of, inequities, it's hard to think that you can just put a tool in there or draw data out of there and not have to address, the unfairness that shapes those tools and that data. And I think in mental health in particular, and both of you, Dr. Supekar and Dr. Adeli, you've mentioned that, part of what AI can help address is a certain amount of what I've sometimes heard described as, squishiness in diagnosis. And I bring that up because I think mental health has some real important examples of how data, for example, really can reflect some of the inequality in the system that needs to be addressed. So something like schizophrenia, you have this category of schizophrenia, and as you mentioned, Dr. Supekar, there's not a sort of right now a biological test, and instead it relies on people applying or doctors applying criteria for schizophrenia. And what they found is that right now, for example, a lot of times Black men are disproportionately diagnosed with schizophrenia. The same with Latino men. And there's different reasons for that, but it often reflects cultural attitudes. It can reflect broader social inequities, that some of the stressors that these men disproportionately experience are also stressors which can interact with someone's biological predispositions, but also attitudes of doctors themselves. And so then when you are drawing from, for example, electronic health records, in order to train an algorithm, or even genomic data, where, the genomic data, relies on, this person was diagnosed with schizophrenia and here is their genome. There ends up being a number of ways that, in the data itself, that it can end up reflecting the sort of disproportionate diagnosis of, Black men, Latino men. And if you're going to try and address it, that's where it goes beyond technical fixes. It goes to trying to figure out what are points in the system that can help best address, the data or the way that, the system is going to end up being using, tools to address mental health. So, some of it is recognizing this problem, recognizing that actually there's going to be a number of different ways that behavioral data is shaped by inequities in society. And then really, take an approach, it's been described sometimes as a pipeline approach of, looking at all the different steps that it takes in the development of AI and really sort of thinking through whether it's addressing what questions can even be asked of this data, or what data is needed in order to really address this question through an algorithm. Who is involved? Making sure to bring in different perspectives, and not. I know often people think race, gender, but really a really broad range of perspectives, and then again, attention to not just the tool itself, but how it's going to be used, and how those questions of, who is going to have access to it, how can we increase access to it, and all of those questions, needing to be addressed throughout the system, are a way of, really, getting at these issues of bias and fairness.
Yeah, again, fascinating insight. I think I'm so glad you also mentioned, because a lot of the focus has been on having technological fixes. And of course, they are important, but a lot of times these systems are trained on data, and the data have inherent biases, because, as all of us agree, and as you mentioned, that there are inequities in the system which could lead to many, many downstream consequences, include diagnostics, access to treatments, and so on and so forth. So going sticking to the point of inequities, we know that health inequities is such a big thing and it exists. And so Dr. Adeli want to know that, how can we ensure actually that AI tools which you are developing in mental health care actually do not sort of increase the inequities? How could we address the problem of how could we make it more accessible and beneficial to diverse populations? Because as you said, as Dr. Martinez mentioned, the data itself is sort of biased, because the equities in the system. So how could we not make sure that we are not perpetuating that inequities which are already such in a high presence in the mental health care space, and how could we do that?
Yeah, very, very important topic, and I'm glad that this is brought up. So, to ensure that AI tools are accessible and beneficial to diverse populations, I think we've talked about it. Firstly and foremostly, it's crucial to develop algorithms based on diverse data sets that include participants from various demographic backgrounds. We are talking about bias, and we heard also amazing comments about that from you, Dr. Supekar and Dr. Martinez. I want to mention that it's also important to acknowledge that societal biases can unintentionally seep into the research data sets. So despite our best efforts to prevent them, that's happening. That's going to happen. Therefore, I always have this in mind that in addition to putting a big emphasis on collecting bias-free data sets, to ensure tools benefit diverse populations, it's important to and also essential to use AI not only to detect these biases, but also to develop other AI strategies to mitigate the risks of these biases and the risks they pose. There are a lot of recent developments on data harmonization, AI tools for data harmonization that could harmonize the data in the sense that it gives the same opportunity to data from populations that are least present in the data sets, and create more bias-free data sets, algorithms. So for doing this from technical point of view, yes, it's algorithms, but from project, the entire project workflow point of view, collaborating with community organizers and healthcare providers can help tailor AI tools to meet the specific needs of different populations. Moreover, designing AI interfaces that are culturally sensitive and available in multiple languages is another important aspect, and that's why one of the major projects that we are running, the project that I told you, it's the pre-rooming stage of mental health visits. We finished a pilot on English-speaking participants, and now, as we speak, we are running one for Spanish-speaking participants, and we are planning to expand that. But yeah, I think data set is important, and it's also important to build in bias-free notions in the algorithms. But all that aside, we need collaborations with all stakeholders to develop tools that meet the specific needs of diverse populations.
Yeah, these are like great set of suggestions, and you know, and I'm so glad that you're following the due process of actually doing it, because I know it takes time and effort, and but it's important. It's important to do it. But you know, for my interactions with people not in academia or a bit in industry, I think a lot of times the focus is on technology, and let's get technology to solve a problem so that we could develop maybe perhaps using LLMs to have a support system, right? But these important ethics and bias things are sort of either people are not aware of, are not taken into considerations. So, I think they're important. So the question to you, Dr. Martinez, is, how do we ensure, and what kind of policies should be in place so that anyone, be it in research, be it in industry, who are developing AI applications in mental health, which are going to happen a lot, they should be effective, equitable, and ethically sound?
Thank you for this question. And in terms of policy, I actually want to go back to, Dr. Adeli. I mean, one of the first things that I would say are, community engagement, stakeholder engagement, talking to the clinicians. And so it was really wonderful to hear you already espousing, that type of model, because it is really important to engage with people for a number of different reasons. I mean, some of it is just seeing, will this approach work from the point of view of people who are impacted by it? It can be really important also, early engagement can also impact things like, what things that you want your tool to do can actually provide the most benefit for a particular community, a particular patient population. So I think those are a really important part of policy, is just making that kind of engagement a more regular part of the process. And again, Dr. Adeli, really wonderful to hear how you engage in it. And I also want to underline that, when we're talking about the data and getting more representative data sets, that kind of community engagement can go a long way towards helping support practices also that support these more representative data sets. That there can be different reasons why some data sets, that they aren't as representative of different populations. And, particularly again in the mental health space, where some people, because of their their particular mental health needs, you may not see them or they may be invisible in some data sets, and so having that outreach can also really help improve sometimes that recruitment for research purposes as well. I would also underline interdisciplinary involvement, that having some part of the process or policy supported that, brings in sometimes people from different fields who have relevant expertise to comment on a project or an approach can be really useful. Stanford, their human-centered AI, for example, they have an ethics review board for proposals that go through there where there's interdisciplinary assessment. You may have a sociologist or historian who's looking through these models. And as much as, we've been underlining how this is cutting edge stuff, many times a historian, a sociologist will be able to point to all sorts of examples from the past that can help inform better understanding what kind of impact is this going to have. And again, underlining this for, mental health. We have, a wonderful field of, psychological anthropology, looking at the history of, processes of diagnosis and all of that can actually help, having a moment where there's that interdisciplinary involvement can really help inform by saying, these are some of the previous pitfalls. These are some of the ways that stigma was a problem in the past, and that maybe using this approach might help more. And, even things like understanding, how we define things like representation in actual practice, by having that involvement, at least at some part of the process of some people who come from different disciplines can actually really help support a stronger project that's going to be of benefit to more people. And again, going back to Dr. Supekar, those educational efforts, whether it's with students who are, developing and designing, or putting together the education for clinicians to better understand, what are the real limitations of this? You're going to use this tool, it can have a lot of benefit, but it will also better support that benefit if you understand the limitations. And so, those kinds of policies can help really support a more, equitable, ethically sound, AI for mental health.
Yeah, that's just wonderful. It just stresses the point that we need to have these policies. Unfortunately, they are still work in progress. Not just policies, but we also need to have the infrastructure and the review boards along with the education so that the public and people who are involved in developing these applications are educated about what can be done, what cannot be done, along with these set of, I would say, mentors like you who would provide them feedback, right? Because right now those things sort of don't exist. So I'm an idealist that think more positive. Let's assume that we have all these things laid out and it's perfect, and there's no argument, and we have the infrastructures and the processes laid out. And just talking about future, and like Dr. Adeli, how do you think, if you have everything sort of perfectly set up, how do you think AI will change the landscape of mental health in the next decade or so?
Well, I believe in the next decade or so, AI has the potential to change the landscape of mental health treatment by providing personalized real-time monitoring and intervention. So AI could enable more precise diagnosis, predictive analytics to prevent adverse events, and automated support systems that offer continuous care between clinician visits. This could lead to more proactive and preventive approach in mental health care, reducing the burden on healthcare systems and improving patient outcomes. An example of these would include the ambient intelligence systems that I talked about that monitor an individual's health and identify any risk factors early on. One last thing I want to mention, which is a little bit probably new to this discussion today, while the dominant AI efforts in psychiatry these days are primarily concentrated on creating AI therapists or early detection of mental health markers, or even some treatments, the potentials of AI extend well beyond these singular applications. In the foreseeable future, I anticipate the development of generative AI algorithms that can enhance brain stimulation and non-invasive neuromodulation techniques to treat depression and anxiety. Very similar to how current drug discovery research is utilizing generative AI to find new drugs. Similar type of technology could be used to plan treatment and basically help the individuals by performing non-intrusive brain stimulation and so on.
Well, it's so glad to hear your positive outlook, and I fully support. And I hope that, everything you mentioned comes true, not in a decade, but hopefully in the next 5 years, so that it's a field which needs help. And the technology has, as you mentioned, in other domains, shown a lot of promise, and also has delivered a lot as well. And so we are hopeful that, it will happen. So the question to Dr. Martinez is, if we how should regulatory frameworks adapt to accommodate this anticipated exponential increase, if I were to say, in AI technology within the mental health care space?
Thank you for that question. And I think actually with what Dr. Adeli just said, it really takes me to thinking about needing, whether it's necessarily through a regulatory framework, but needing a framework more for some coordination. There's a number of siloed actors, I think, whether it's industry, whether it's academia or otherwise, where I think more coordination towards the type of question that Dr. Adeli was asking about, why all of this hype and promotion of, AI to replace a therapist, and instead, what kind of coordination can come into being to really look at where would we really see the most benefit from applying AI specifically, which, as Dr. Adeli was saying, are in these, promising areas of generative AI, and how it might be applied within treatment. And of course, we've also talked about diagnosis. So I think, some move towards some more framework for coordinating, how to realize some of these benefits. I saw a number of people as I, interview people who are developing AI in mental health, where, wanting to have more coordination and conversation. What are the ways that AI tools might be made that, for example, might have a more coordinated effort to help people in crisis, for example. But also, just for some of the ethical issues that I mentioned previously, privacy, there needs to still be improvements in a regulatory framework to protect data and privacy, whether it might be limitations on data brokerage, so that you can minimize the harms that come from, having people's data out in the wild, as it were, for, that might have an impact on them. The FDA, as I mentioned, still has a number of challenges, and so still some improvement on what kind of requirements they might have on things like representativeness of data sets that are being used for training mental health AI, that they're tested in multiple sites, that kind of regulatory framework. And in professionalization, there's been some wonderful efforts in professionalization. For example, Dr. Laura Roberts and Dr. Laura Dunn here at Stanford, or Dr. John Toros, to put thoughtful work into frameworks for psychiatrists and psychologists to better evaluate, know the limitations, know the ethical challenges of digital and AI mental health so that they can, again, more realize that benefit. Because again, I also take that optimistic approach of there's a lot of benefit that can come from mental health AI. And so putting into place these ways that help better protect in areas of privacy, fairness, or just coordination of resources, I think can really help realize that benefit.
Yes, absolutely. This is an interesting discussion, and I want to actually go back to you, Dr. Supekar, since you mentioned you're teaching this course AI in psychiatry, and also I know of your amazing research incorporating AI in different applications related to psychiatry. I wanted to ask you, what steps should healthcare providers take to stay abreast of new developments and ensure they are equipped to integrate these innovations into mental health care delivery?
Yeah, glad I brought it up, and it has been brought in many conversations. And the first and the foremost, which I always preach, is education, education, and education. Healthcare providers, there's a lot of misinformation about AI's capacities and capabilities. And the best thing to do to begin with, healthcare providers should participate in ongoing education and training programs to stay updated, to understand the limitations, as Dr. Martinez mentioned. And knowing the limitation is very, very important, even more important to understand how the technology works. The other aspect would be building collaborations, as we have mentioned, with technology experts, engaging interdisciplinary teams, including historians, sociologists, ethicists, which can also facilitate the integration of these innovations into clinical practice. And last but not the least, attending conferences. And one of the things which I've seen working a lot is like participating in pilot programs where you actually implement a system in your clinical setting. So you could perhaps, if you are working with individuals with depression or anxiety, you could collaborate with Dr. Adeli and take his solution and implement in a small setup. Because once you have these hands-on experience, that's the best learning way of learning a technology and what it can do and what it cannot do. Of course, within the purview of regulations and everything else. But if there is a pilot-based project which you can really engage, not just with technology, but also with your patients, right? Because the pilot project would also allow you to do that. That would really go a long way, which will enable the providers to understand and apply these new tools effectively in their clinical work, perhaps now or in the very near future. Well, I wish this went for hours together. This is such an amazing discussion, learned a lot. I would really like to express my heartfelt thanks to Dr. Adeli and Dr. Martinez for sharing that insights, personal stories, and more importantly, their time with us today. Your contributions and discussions have really shed light on the immense potentials and the critical considerations of AI in mental health. To our audience, thank you very, very much for your attention and engagement. We hope this session has provided you with valuable knowledge and perspectives that you can apply in your professional practice. Thank you very, very much.